David Kelly. I'm a member of the West Virginia House of Delegates, and I'm the Deputy Speaker of the House. My wife Jan and I moved to this area about 15 years ago. We lived right in Sistersville at the time. I'd had kidney stone surgery, and nothing went right about that surgery. That surgery was done, of course, in another area. And I began to have complications that only got worse as the days went on. And one of the complications resulted in a new medication that I was given. But I did have an allergic reaction, which took me into anaphylactic shock. And by the time I realized what was going on and was able to tell my wife, Jan, it was, I believe, critical. She drove me to the hospital, which was just a couple minutes away, if that, and they were right there. They took care of me. I attribute them with saving my life that day.
Sistersville is a community-based hospital. It's over 100 years old. It's a critical access hospital that helps serve this community. We've been promised for approximately 20 years of a new hospital. Different hospitals have looked to acquire this hospital. Memorial Health System was actually able to do that. It's important to see it finally come to light. I think procedures will come to this area that haven't been available before. Things that this area is needed.
I'm Alice Bungard, and I've lived in the area all my life. And I have had several roles in the hospital. Everyone that, I talk to about are excited, and this area means a lot to me because my family are all here, and just everything I look at and see is part of me, and I just love it here.
Sistersville Hospital, I think, is probably one of the best things that this town's ever had because it's so close. It's saved a lot of lives. I believe that we'll see some growth in people coming back to town. People are already talking about that because they'll have the services right here real close.
Well, I think it's one of the key, most important things to come down the road in Tyler County in my lifetime. We've always been lucky to have, as a small community, a hospital. But as everything else does, it ages. Just like some of the industry around here, you need updated. And we believe this is going to provide us health care into the future for past my lifetime, maybe my grandchildren's lifetime. So we're extremely excited about it.
I think it'll mean a lot to us here, especially with the older people. There's a lot of older people that stayed with Sistersville Hospital in there.
Well, for close to 1,600 people in this region, this will be the closest medical facility, the closest emergency room, and the closest source for specialty care. So that's very important to the folks who are here. And again, from wearing my community development hat, is very important to attract new residents, which we need.
As soon as we heard the opportunity that Marietta was working with the state, to the county, to the other municipalities, it was a quick decision for us because of the need of not just an updated facility, but also the long-term longevity of the medical field and the medical profession within Tyler County.
Had I had to go out of the area, I don't think I would survive to get there. So when you ask me what does this mean to me with a new hospital we're having Sistersville here, it means everything to me. I owe my life to that little hospital.
What we're doing here is more than just a hospital. It's a promise for our community to continue health care.